What's up, guys? It's Dominique, aka that therapist. For those of you that don't know me, I'm the lead clinician and CEO for a group practice known as Yellow Bird Counseling. Some of y'all might be like, well, what do y'all do? What is that? What's the Yellow Bird Counseling? Well, our normal day-to-day activities include providing individual, couples, family, and group mental health therapies, okay, in the states of Alabama, Louisiana, Mississippi, New Jersey, and Idaho for now, and then more to come. Way more than that to come. But that's what we're doing right now. And we do that Monday through Sunday. So if you're looking for individual, group, family, couples, Jerry or elderly or child, adolescent therapy in those states, I will give you our information in a little bit so you can reach out and we can get you set up with one of our lovely clinicians. Now, why are we here on social media? Well, the whole mission of Yellowbird is to contribute to the effort to break the stigma that surrounds mental health and wellness by educating you all, the general public, on reasons that we could all benefit from having a therapist outside of simply just having a mental illness. Therapy is supposed to be as normal as going to the doctor for a checkup, the dentist, the eye doctor, the OBGYN, urologist, whatever. It's supposed to be that normal. So we're making it normal. All right. And debunking myths of why people go to therapy, because a lot of people are like, I'm not crazy. I don't need to talk to nobody because I ain't crazy. Well, guess what? If you were technically crazy, the true definition of crazy, what we do here, we wouldn't be able to help you. You would be in somebody's lockup somewhere, some facility somewhere, if you were truly crazy. And I'm not talking about just a mental health hospital. I'm not talking about that. I'm talking about, criminally insane. Okay? That's what I'm talking about. So we wouldn't be able to help you. So no, it does not make you crazy to come see us. All right. So, yeah, but this month, guess what? We are honoring Disabilities Awareness Month. And each week we're going to keep bringing you a topic to educate and bring more awareness to, different disabilities, I hate to say what they look like, because y'all already think y'all can see a disability, when a lot of disabilities you can't see. So what their symptoms are, we'll say that, look like in symptom wise, okay, and how they can affect your mental health. So that's what we're going to be doing. Of course, I'm not going to be doing it by myself, because guess what? I'm not the smartest one here. Okay. I have other people that know stuff too. And so I got y'all somebody. Without further ado, let's bring her on.
Hi!
Yay! Oh my gosh. It's intern Lindsay.
It's me being a menace like usual. How y'all doing?
It's intern Lindsay, everyone, and she is very, very, very. Oh no, I don't want that one. I don't want that view. She's very smart. She knows a lot about a lot of things. Tell them what you know about.
Oh God, what I like to say that I am a student of many verses. I tried my best to learn everything. I learned that's what is it? Resource? It's not resource gathering, but it's a part of being a neurodivergent person. That's the way I learn. I like info gathering. That is my thing. I love it. So I try to learn as much as I can.
What are some topics you know a lot about?
Spirituality. I've studied many different religions all of my life. I'm currently working on Islamic psychology. that is my newest form of study right now, which is really interesting.
Super cool.
I'm very excited. And then I know a lot about sex workers, and I'm actually about to be certified in working with sex workers officially. So that'll be soon.
We're
I know a
excited.
lot about gardening, so that's what I've been doing this week.
You said gardening?
Yes, love
Tell us,
gardening. That's a
tell us
great
what
form
you
of
planted.
self-care.
What'd you plant, Lindsay?
I planted 4 berry bushes yesterday, and then I got some seed potatoes in, and some garlic and some shallots. So I'm gonna be planting a bunch. It's honestly ridiculous. So be prepared for those at the office to get some vegetables.
Ooh, I will take some. I'll take some of that.
I'm trying to think. I know a
Yes.
lot about LGBTs in our history, especially. I know a lot about drag. I actually learned how to do makeup through drag. So that is one of my specialties. I also know a lot about chronic pain as I experience it every day, which is such a good time. And
Yes.
my sister has cerebral palsy. So I have a firsthand knowledge on what it's like to live with somebody with CP and kind of what they experience as well.
Well, tell us about it. Tell us first. Tell us about your. Tell us about you. Tell us about your chronic pain and that.
Oh, so a lot of my chronic pain is because I have PTSD and my emotions actually manifest through a back condition that I have that I got from when I was little from a fall. So I have been dealing with back pain since I was 7 years old.
Mm.
I also have mild scoliosis, tall people problems, but that is something that I deal with on a daily basis. I have severe sciatica. Some days I can barely walk. I can't feel my leg half the time. But when I do, it feels like I have literal lightning running through my body. I've actually been electrocuted by accident before. Feels very similar.
Ugh.
Don't touch wire fences. Just a
Ugh.
pro tip. So it feels like that. And I've always had back problems. It's something that I've experienced for a long time. I've seen back specialists. I've seen a specialty physical therapist, and she's helped me out a lot. I've been seeing a chiropractor since I was 16. I no longer see a chiropractor. They do a lot of good, and I very much appreciated the work that I got from them at the time, but I felt like in my own personal case, it wasn't working for me as well as it used to. So I decided to save some coin.
Yeah, that part.
Yeah. I also get migraines on occasion. I'm actually having one come on now, so I'm hoping I make it through today.
You know what? Yikes. We both got a headache, but yours is probably worse. I got these bright lights. I had a headache, I think, from not getting coffee today, so it's not a migraine.
This pollen is kicking my tail. That's all I'm gonna say.
Ugh, sinuses, awful.
Yep.
So, okay, so yeast. So, how do you know when your pain is chronic pain? How do you know that?
So, chronic or persistent pain is typically diagnosed when you have symptoms that carry on for longer than 12 weeks, despite medical intervention like taking meds or surgeries. Sometimes your chronic pain is because of surgeries. It is unfortunately not curable, or it can be managed, but some days are better than others. This is what we say about our mental health as well.
Mhm.
A couple of treatments for chronic pain is having surgery, being mindful of the inflammation that you're experiencing. A lot of chronic pain disorders are because of inflammation. Mine is. So I've been working on that. Also taking medications. Personally, I'm an Advil girly. Love me some Advil. But there are some days where Advil does not cut it. Unfortunately. And because of my family's history of addiction and my own personal history with it, I try not to take opioids just because that's my personal preference. So yeah, unfortunately, there's not a lot of different treatment options, but a really good one is cognitive behavioral therapy, which is one of our verses. It's my go-to. I know it's Dominique's as well.
Mm-hmm. So tell us about that cognitive behavioral therapy with chronic pain.
So, as I mentioned earlier, a lot of my chronic pain is because of trauma that I experienced. I have PTSD, and I store it in my lower back and my hips. Also, your shoulders. So, if you have chronic shoulder fatigue, it may be worth it to go get checked out by your doctor to see if that is something that's going on physiologically or psychologically. Um, and if it is a condition where it is physiological and there's not much you can do about it, you can use cognitive therapy to kind of reframe how you look at it and how you look at yourself.
Okay. That's interesting. Tell me more about that.
Tell me more. Okay. I use a lot of thought reframing in my own personal journey with therapy. Because we had to remind ourselves that we are more than the pain that we experience and we are more than the trauma that we have experienced. And if you are a person that stores trauma in your body, working through those traumas, whether that's I lost my train of thought because Mr. Carter.
Mr. Carter, I mean, man. Hush, Mr. Carter. You'll get a pop on his butt. You don't want that.
I don't know who's being more of a menace tonight, me or Mr. Carter. And honestly,
Him. Always him.
So, using cognitive behavior techniques, you go through trauma processing. And I have noticed the more that I work through my own personal trauma, the better that my pain has gotten. And also the way I think about my body and the way I carry myself mentally and physically.
So, okay. So what does that look like practically to utilize cognitive behavioral therapy to contribute to your pain management? What might you do as a therapist?
As a therapist, being mindful of what your client is going through and saying, being open about how their pain affects them, because your pain really affects you psychologically. I know it's really contributed to my depression as well. So in giving them homework and stuff and treatment, being mindful, there are some days where you're not going to be able to do the things and focus on anything other than the pain that you're experiencing. So keeping a pain journal, and thoughts and behaviors that contributed to that pain, or notice if you notice that it's exasperated it. That's one good way. I'm trying to think.
So with the pain journal, what does a therapist do with, like, when the client brings it to therapy?
So typically they would look for common symptomologies within, or common themes within the pain journal, and things that they are mentioning over and over. Like a lot of people that experience especially hip pain or pelvic pain is because of sexual trauma. So maybe going through working through that through trauma processing, if they have the space for it. So being mindful of that and noticing what times of days and if certain meals or something impacts your chronic pain. Like if you have a food intolerance, that'll make your inflammation go up and therefore your pain gets worse.
Gotcha. Okay. Good. So okay. So what about somebody who might have been experiencing chronic pain, like you've been experiencing it for years and years? Um, does it like so when it worsens, what do you think you might do therapy wise?
I would offer a supportive space and ask the client how they would like to be supported and what they want to work through. Um, Dealing with chronic pain, because most of the time it's incurable.
Mm-hmm.
Um, Almost doing like a form of acceptance therapy with it, where you spend all of this time like, this is something that hasn't changed in a long time, so you kind of like bring it with you like a little
Mm-hmm.
backpack. um,
Mm-hmm.
so the way you carry the things that you carry on a daily basis.
Gotcha. Gotcha. Okay. Yeah. Yeah. I can imagine it may take a lot of therapy for it to be impactful.
Yeah, it does. I've been working with my own personal therapist since 2020, and we're
Mm.
still working on some of the same issues.
Yeah.
Like, there are some days where I am so angry at the fact that my body hurts all of the time and I can't do the things that I used to.
Mm-hmm. Mm-hmm. Yeah. So you said you had your sister uh has been diagnosed with cerebral palsy. How does that differ, if at all, from chronic pain?
So, cerebral palsy is actually a group of disorders that affects a person's ability to move and maintain balance and posture. And if you are stuck in a position for a really long time or have trouble moving your muscles, it does cause a buildup of pain.
Mm.
Um, and again, with trauma storage, sometimes if you experience pain in great amounts, and you have cerebral palsy, it can make some of your other symptoms worse. Um, it's the most common motor disability diagnosed in childhood.
Mm.
It's typically You're typically gonna find that diagnosis within the first 6 months
Mm-hmm.
of life. So it's found really early. Um, People with that have cerebral palsy may also experience intellectual disabilities, seizures, problems with vision, hearing, speech. It also really impacts your spine um, and your joints.
Yeah. Yeah. So what might be some mental health symptoms that come along with that, with cerebral palsy?
It's different with every case just because
Mm-hmm.
there's such a wider range of symptoms. There's actually 4 different types of cerebral palsy. There's spastic, which it means that you have stiff muscles, and you have increased muscle tone. Um, so it actually it's that's also categorized based on which part of the body that you experience it in.
Mm-hmm.
Um, like for instance, quadriplegic, it affects your trunk, your arms, and your legs.
Mm-hmm.
Um, and some people, they have it on one side of their body.
Mm-hmm.
So it depends on kind of how it manifested. Um, and they're not sure the exact cause of cerebral palsy. The best guess is a lack of oxygen in the brain during delivery, or um, effect or something that happens in the development of the brain.
Gotcha.
So
Gotcha.
many different
So
things.
so what might be some focuses that a therapist may uh uh be aware of during, with a client or patient that has cerebral palsy?
Being mindful if they are using any ability aids, being mindful that they have the proper aids that they need. I know some people use they're like arm brace, but they're kind of like walkers. I forget the exact term for that. Making sure those are at the right height and making sure that their aids are in good condition. If they have intellectual disabilities, working on them with based on where they're at cognitively.
Mm-hmm.
And making sure that they're going to physical therapy, or if they need to find physical therapists that specialize in CP.
Mm-hmm.
Another thing, just like general disability cognitive behavioral therapy.
Mm-hmm.
There's a special track for that.
Mm-hmm. And probably rehabilitation counseling, maybe.
Yes, that was the word I was trying to think of. Sorry, this migraine is hitting. The brain fog is getting there.
It's okay. It's okay. I understand. Well, shoot. I mean, I told them on Instagram I was learning myself, but definitely, we want to let everybody know, if they have some, if they have their self or someone else that is experienced. We actually have a few therapists that have worked with chronic pain. But Lindsay and a few of the other therapists that have even worked with chronic pain, like in clinics, so providing therapy. So definitely, if you or someone is dealing with that, definitely give us a text so we can support you, or the family member. Even if you're the family member of someone dealing with chronic pain, definitely we can provide you with therapeutic support there, because I'm sure that's not easy for the person experiencing it, and maybe their close supports. It could be a bit to learn about, and because you do have to pay special attention, and maybe think of things different.
And I will say, as kind of the typical child, which I don't think I'm a typical child anyway, but it's just me and my sister. My sister's older than me, and growing up with a sister that has these different abilities, how that impacted my growth and my development. Just because my sister needed more specialty care than me. And when you're younger, you're kind of aware of that.
Mm-hmm.
So that was something that I'm still working on in therapy myself, because it's something that, especially people who have siblings that have disabilities, that's not something we talk about very much, because it's almost like a taboo, because it's not something your sibling can help.
Yeah. So if you have children who have a sibling with a disability, we want to provide them both with support, but being aware definitely of the child who may not be dealing with the disability, and the extra support they may need as well. And then Punky Brewster said, what's that nerve that gets overloaded in trauma survivors?
Your vagus nerve.
Vagus nerve.
That is the nerve that controls your sympathetic nervous system, which is your fight or flight response.
Mm-hmm.
Also your spinal cord. So if you have spine issues, that will also mess up your fight or flight response.
Yep. There you go. Well, shoot. Trying to think, that might even be it. I think both of us is fading. We both had headaches, and I'm just like, mm-hmm. But this was really great information. Seriously. Hush, Mr. Carter. Jeez. Mr. Carter, pop, pop. Pop, pop, Mr. Carter.
I'm reading the comments because I have the live pulled up on my screen.
Oh, yeah.
I'm working on acceptance therapy with you, Punky Brewster.
We love it. We love it. But definitely, let's see. I was gonna ask one more question. I can't think
Oh,
of.
I didn't go over the 4 types of CP.
Oh yeah, what are those?
So spastic is the most common with 80% of cases. That's the increased muscle tone, which causes the stiffness. Then there's dyskinetic CP. That's when people have problems controlling the movement of their hands, arms, and legs, and that
Mm-hmm.
can make it difficult to sit and walk.
Mm-hmm.
Sometimes it's slow movements, and sometimes it's like quick and jerky movements.
Mm-hmm.
Then there's ataxic CP, which is when you have problems with balance and coordination. And the last
Mm-hmm.
one is mixed CP. So if you're, experiencing different or a multitude of symptoms between the different types of CP.
Gotcha.
Um, my sister has mixed CP. She has trouble with her balance, and she also has trouble with, she has spastic CP as well.
Yeah. Yeah. So yeah, I know I've learned a lot. Like I was telling in my IG, I didn't really know a whole lot about CP or chronic pain really. So it's good, that again we have other people with more and other knowledge than me, so that y'all can really get a well-rounded sense of how you can benefit from therapy. And these things aren't, anything anyone can help, so.
And I will say to the counselors watching, if you do have a client that experiences um, that has a physical or mental disability, I would say read up on it as much as you can. It's not your client's job to educate you on their problems, especially if
Yeah.
it's common knowledge. I actually learned a lot about CP that I didn't know. So I didn't know there were 4 types until today.
See, so make sure um, and that's with anything with LGBTQ. That's, I know we're talking about disabilities, but all the therapists watching, that is also your job. If you're a white therapist working with Black and brown people, that is also your job to educate yourself. So yes, I'm glad Lindsay said that. All right, well, shoot. Let's see.
I saw in the comment section, are there people that can walk normally with CP? Yes, there are. Symptom severity depends on different cases. It can also manifest only in the top half of your body, like I was saying earlier. It can only affect your spine. It's really interesting how much change a little part of our brain, if something happens to one little part of our brain, how much change that causes and how it affects different areas of your body.
Yeah. Yep.
Whipping that back over to chronic pain, if you have if you have a long battle with depression, drug use, anxiety, and you have a lot of like dissonance between your neurotransmitters, like that dopamine, epinephrine, norepinephrine, serotonin, all of those beautiful and lovely things that keep us alive. If there's about a disbalance between that, it can also manifest in different parts of your body. If you have stomach issues, that can also affect your brain because you keep your neurotransmitters in your tummy.
A lot of people don't know that. Most of your neurotransmitters are there.
It's because your fight or flight system is in your spine, so it gets to your brain quicker that way.
Yep. Cool. Well, shoot, Lindsay, what else you got for them?
I'm trying to think. Make sure you get your rest. Try to
You get
eat.
to rest.
It's really good for inflammation. Make sure you're taking your vitamins. If you struggle with inflammation like me, fish oil and omega-3s are really, really good for your brain health, your heart health, and for inflammation, as well as taking vitamin D. Inflammation is also a symptom of seasonal affective disorder. case y'all didn't know that. So making sure you're eating a well-rounded diet. Make sure you get your veggies in, especially those green leafy veggies. Try to get some sunshine, get your exercise in, which is something that I've been trying to get more into.
Me too.
A new part of my chronic pain journey is trying to gain some muscle back to see if I can get my strength back. Because I don't know if y'all knew this, but when I was a teenager, I used to box all the time.
Ooh.
And my back used to be so strong, and that was the only time where I didn't have chronic back pain. So I try to get back to that point.
Yeah. That's cool. Cool. Were you sparring?
Yeah.
You really?
I used to spar with my dad. Like, actually, he taught me how to box. I don't fight your parents, although sometimes I know y'all want to. Don't fight people.
Well, cool. Enjoyed it. I think we learned a lot, even in this short time.
I certainly did. Thank you for having me on.
Awesome. Thank you for coming. Thank you for coming. You get you some rest.
I definitely will. See y'all
Bye.
later.
Well, y'all, we're committed because I'm fading too with this headache and I don't know, feeling queasy. So I'm going to take care of myself. Y'all take care of y'allself. And please definitely share this live because there was a lot of great information that Lindsay gave that, I didn't even know. So definitely be sure you share this live as your contribution to supporting Disability Awareness Month. And we will see you next week. Hopefully everybody will be healthy. All right. Thanks. See y'all later.